Teşekkür ederim.
Thank you very much. You are saying very nice things about me that I do not deserve. Hopefully, I will not disappoint the audience. In children with ADHD, what happens in the adulthood? Is adult ADHD diagnosis is real or virtual? So this is very much discussed amongst adult psychiatrists, because when the children come to 18 years of age, the psychiatrists are not usually diagnosing the adults with ADHD. So there is no biological parameter which disappears into adulthood, but which does not does disappear at the age of 18. So we do not automatically treat a patient at the age of 18. This disease, this disorder continues throughout the life. However, it just gives symptoms based on your environment. If you're a child, you have to go to school and you have to get academic achievement, and attention is important there. If you're a child, you are falling down and you're getting up and you are getting hurt and injuries, and there are three components: attention, hyperactivity, and impulsivity. Impulsivity component is more related with hyperactivity rather than the inattention. So when you are a child, you may have problems in the academic field, and you have to get help for that. Of course, during the years of education, you will get help. However, what will you improve in terms of attention deficit at the age of 25 years of age? Because there's no academic life, and deteriorated social relations, deteriorated family relations, and these children, girls, in other words, may have experienced certain disorders, including sexual trauma. And at the age of 18 or 20, we just diagnose them with personality disorder. Before 18 years of age, we cannot say personality disorder. We were diagnosing this order until the age of 18, therefore. But in DSM-5, different changes were made. And from now on, I think we will be able to diagnose ADHD after the age of 18. And so when there is a patient which is diagnosed, and when this patient comes to us, we did not know what to say about that patient. So right now it is going to be more clear for us. So until now, the diagnosis of psychosis and neurosis were already definitive before DSM. And as we have more increased treatment agents, we are observing the differences even in a better fashion. Right now there are ICDs and DSMs, and definitions have been made thanks to these instruments. And from now on, we will be able to make more detailed definitions. So biology is very different, so the people working in the field can easily see this. So I do not want to waste my time, but I would like to start an anecdote. A friend that I did not see for the past 15 years came to visit me the other day. I did not see him for 15 years. And this friend was very active. And I asked, your child has to be taking the university exam this year. And he said, I have two daughters, and what about their attention? And he said, they have very bad attention, because the father is hyperactive. And when he said that there were some behavioral disorders in the children, and I asked him to bring his daughters to me, and we looked at these, they could not go to the doctor, and ADHD treatment started with these girls, and the family is very happy about that. So it is, if you have it, your child is going to have it in the rate of 60% or 70% or 80%. The adults or the community at large thinks that this is a disease. It's in English, it's a disease. So it's considered to be as like a hypertension, diabetes, for example. If you have this level of insulin, it's going to be this disease and that. No, this is just a disorder, and you cannot talk about the absence or existence of this disorder. And the symptoms are useful to a certain extent. They are very creative, they have huge imagination, and if executive functions are not deteriorated, they are very successful. They never get tired, and they can just sleep for 3 hours or 5 hours a day. So we have to prevent the perception of this disorder as a disease. So we should accept that the symptoms in an adult may be different from the symptoms in a children. So, of course, there is such a perception in the world. You are giving drugs to children. These discussions may be valid in the USA and Canada because in 1996, 50 million prescriptions were made for stimulants. In 2013, in Turkey, we only write 1 million prescriptions. So I think these discussions may be valid in the USA or in Canada, but it is not valid in Turkey. So there are people who are reading the Western literature and coming to Turkey and talking about Turkey's situation, but they are making a huge mistake. So they say that these prescriptions are going to take us to the darkness of the medieval ages. However, we cannot talk about such a darkness in Turkey. It is valid for the Western world. Yes, that's right. So this is the percentages of diagnosis in different parts of the United States. And it is very obvious that these are the rural areas and these are the urban areas. As there is more attention on academic achievement, you have to have more attention on attention as well. So this is the hyperactivity disorder. This is higher and this place is lower because there is the rural population here. Yes, as we give more importance to education, we will have more income, of course. And if you have less academic achievement and less education, you're going to get less money, of course. In the past, people were asked questions which would measure the IQ. And these ADHD patients were not very much noticed. However, the children are now subject to different academic tests, therefore they can be very much easily differentiated. So in the high school education system, such extreme questions should not be asked. And if that would be the case, the percentage of children in need of treatment would decrease. Maybe we can discuss about that. If we're going to discuss this around an axis, this should be the axis. For example, in DSM-5, it says it is 5% in adults and 2.5% in children. And some data shows that it disappears with adulthood. And majority of them are psychomotor skills and behavior. So there is also a subgroup. Yes, they say that this is not hyperactive, he's just lazy, this person, and it's a subgroup. And in DSM, it was discussed very much. There is a definition of this dyslexic, and there are different types in adulthood as well. And there is one common mistake. They say that people think that every children will be very active, or the family says that I also was like this, and am I sick, for example? And the father had some tests and some examinations at school which would measure IQ. However, right now the children are subject to different academic tests and academic achievements. Therefore, in the past they were not considered to be a disorder, but right now this can be a disorder, and this is a situational thing, I think. In the adolescence, it is 80%, and in adulthood it is 70%. In a study made in 10 countries, adult ADHD prevalence is between 1.2 to 7.3%. One colleague had a thesis, and the adult prevalence was 3.4. And the prevalence is low in low-income countries, while it is high in high-income countries. Because in high-income countries, we have to produce high added value, and we have to get a high academic achievement for that. So this is something situational, and this is another matter of discussion. For example, this is the rich area in the United States, and these are the areas which produce added value. And when they get treatment, this would be the situation. Symptoms of inattention. I'm not going to focus on them very much. However, attention disorder is not going to improve over age, but symptoms may change. Hyperactivity symptoms. Hyperactivity may disappear during adolescence. In a subgroup, they may also become lazy people. However, impulsivity also is reduced through age, and the symptoms change. Instead of impulsivity, they make very rapid decisions. The same symptoms were not changed, but more compatible examples were given in defining the symptoms for adolescents and adults. And especially for adults, it's going to make the diagnosis for adults easier. These examples may be helpful to clinicians to define for each group. For example, often has to difficult to maintain the attention in homework or playing activities. Adults do not do homework, or they do not play, so we did not see it before. So the examples are more appropriate for adults at the moment. And avoid tasks that require sustained mental power protection. Usually he doesn't like this kind of stuff and are reluctant to do it. If you say homework, the adults are not going to deal with that, of course. But if you say report preparation and doing work and some other things, it is going to be, of course, more appropriate. We have a colleague, and this boy is very, very clever and very smart. In the 4th year, he said that I cannot make publications. And one of the colleagues said that tell him this boy should use Ritalin. And this boy started using Ritalin, and right now he published 8 articles in a year. Sometimes it is very, very obvious. Sometimes the psychiatrists can just see the problem in a child with one glance. So I told his friend that this boy should use Ritalin. And usually runs right to left or climbs at environments that is not suitable. For example, the children are playing soccer and everyone is running behind the wall, and they are just running in the stadium. So this may not be valid for the adults. For adults, the number of symptoms required for diagnosis has been reduced to 5 from 6. So when I'm dealing with a child, I have the child to fill out the form, and the family, a separate form for the family to fill it out, and there may be differences in between. DSM-5 talks about age of onset. It is 12 right now instead of 7, and 12 does not have any scientific ground, I think. This is something personal. But we also talk about ADHD with late onset. There is such a subgroup. During childhood, there is no symptom, but after a while, it gives symptom. And this is syndromal ADHD is a subcategory, and in the challenging environments, for example, they show symptoms. I'm not saying that every adult should be treated, but on a situational basis, it may be a must. Pervasive development disorders have been removed from the exclusion criteria, and in patients with pervasive growth disorders, the 50 or 40% of them are diagnosed with ADHD. Cases with CGD plus ADHD response to stimulus less than those with only ADHD. So both diagnoses will be made, and this is 5 now for the adults, and the adults would more welcome this even more. And during adolescence, hyperactivity is disappearing, but inattention disorder is continuing throughout life. And co-diagnosis is very important. The number of general criteria is important, but the development of the person and developed distortions are very important as well. Here, I would like to draw your attention to the symptoms of the adults. All of them are decreasing here, but inattention continues for life. And for example, this person is not tidy. When this is an adult, the table is not tidy, and they lose their stuff very easily, and they have less academic capacity, and they sometimes understand the questions in a wrong fashion. But how are we going to evaluate this in adulthood? If there is the attention deficit, they may not have a problem in the primary school. But if this person is very smart, an IQ of 100, for example, this may not give some symptoms. For example, the parents say that this boy is very smart, but he does lack attention, and in that case we have to look into this kid. During adolescence, hyperactivity decreases, and restlessness is very common, is very typical during adolescence. They just shake their feet and some other things. During adolescence, they may give quick reactions, they may get involved in fights, and they may start alcohol and substance use at a very early stage. They may not be successful in treatment. They want everything together. However, they just go for just 1 day or 2 days like this. You give them some advice, and they say that yes, I will do it, and I'm very determined. I will be giving up alcohol, and I will be giving up medication. Sexual experience at a very early age. For example, if a 15-year-old girl is acting like a 25-year-old girl, then they may have a bad experience. For example, in the Mormon community in the USA, even the strictly religious group, the sexual experience starts 5 years earlier than the average, because they try to become center of attraction, and their risk perception is low as well. They are involved in dangerous works, and they just drive dangerously. Every month, for example, they change jobs in adulthood. And for example, every 9 months they change their jobs. They lack concentration, and they are disorganized. They cannot have multitasking. They cannot complete their projects. They cannot concentrate. And I would like to give you a couple of case examples. Those who receive classical psychiatry education give different diagnoses, like chronic depression, anxiety disorder, or some other diagnosis. For example, they cannot stay in the same place for a long time, and from the cinema, for example, they just suddenly get up and go, and they change their spouses, they cheat on their spouses, and for example, there is a general disorganization. They are very careless in terms of what they say, and that's how they do it. They always delay what they are supposed to do, and they cannot do it, and all the calculations cannot be made. They cannot concentrate while reading, and they read 5 pages and then they go back, and they want to become an intellectual. They purchase the books and they do not read it. But if they like it, they just finish the book for 24 hours, for example. But they just get very tired, and for the second book there has to be 6 months in between. For example, they say I read books, but how many books did you distribute to the half? And this person just gives you the wrong answer. They change their homes, cars, jobs, the places of furniture very frequently. They change their boyfriends, girlfriends, spouses. They get involved in traffic accidents very much. They're clumsy, and they forget everything. So they just hurt themselves, and they cannot say no. They like taking risks, and in a group we can see very they're very courageous. Disappointments, and they just collapse when they are very when they get pleasure, for example, and when they have a lot of joy in doing something, and they have difficulty in commitments, and they are using their nose while they are taking alcohol or substance. So they eat very fast, and they also early ejaculation, and they cannot stand, and they just, if you just force them, they just go away, and they are distracted, and they cannot look into the eye, and they have difficulty in going to sleep and waking up. For example, they are awake until the morning, and they sleep throughout the day, for example. The cortisol peak is shifting, for example. And these people cannot, for example, start studying their lessons and when they're children, for example. There are online websites, as you know, like Twitter. They're always on Twitter. So there are certain tests like Wisconsin card matching tests and Stroop test. These are important for identifying adulthood ADHD. You can have these tests for adulthood ADHD. It's a very strong data. And in DSM, there is no study to differentiate it from other diseases. So we should not call everything ADHD, and we should not, of course, miss it. I would like to talk about one case. For example, there were 4 or 5 cases that I treated, and I said, after the treatments, can you please write down your own observations? And there is no intervention for all of them. One says, 49 years of age, mechanical engineer, and for example finished the school in 8 months, and this is a specialist doctor. In 1998 he went to different universities. All of these diagnoses are right. For example, anxiety disorder diagnosis was made here. All of them are right, and all of these drugs are right. However, ADHD was always missed. Here, these are their words, as they say it. I have never intervened with that. And the ADHD paradigm is ignored. I think this person is going to become a professor at a university, and 34 years of age patient, and he is a mapping engineer, but right now he is dealing with the valuation of real estates for the banks. So even though he made a lot of money, he could not really stand on his own feet, because all of the people he was getting involved with, they were stealing his money. And right now, after the treatment, she's now running a nursery. And the last sentence is, and I know that it is not ADHD is the only friend who will not leave me, because it's like a Ferrari without a brake. Thank you very much.